in the time of caveman, it was fight or flight. So he had to run away from a saber-toothed tiger. So the cortisol went up when he had to run away from the tiger, then it went down. We were built like that. Now in modern day living, it goes up, it stays up 24 hours. That
Because you
burns.
know what the tiger is.
And we
the
know
tiger's the bank.
And we know exactly
what it is. It's running away from your mortgage and your payments, and the bank doesn't close down, man. Even when they say they're closed, they come after.
24 hours?
Yeah, Revenue Canada, Revenue Quebec, that's the new tiger. You know what I mean? They don't stop chasing you when you owe them a little bit of taxes. Not from personal experience. I'm saying this because I'm a friend. Okay, but now I have another question. What's better exercise-wise? This is a big question all the time. Beneficial overall? Weight training, cardio, or the combination of both? Because you don't have time to do both, okay, sometimes.
Yes.
Like you'll have an hour in your day, right?
Yes.
And I know for me, it's like a lot of weight training and a little bit of cardio. So meaning if I do 5 days a week, I'll do 3 or 4 of weights, 1 of cardio, or like 4 of weights with 10 minutes of cardio at the end, 15 minutes of cardio at the end, and then 1 just a cardio session. But I try to do weights more, and I feel like the benefits in terms of weights and cardio are so different.
Yes.
But I like the combination, but I can't equally combine them to get the benefits I want.
What a great question. So that's one of the few we have an answer to. So now we have the answer, but I'll tell you the answer from the longevity point of view. Now it's well established that if you want to maximize your lifespan from an exercise point of view, remember one of 7 risk factors, we need 150 minutes of exercise. Now, per week, 100 exactly. So it's about per week. So it's about 2.5 hours per week is the minimum. We're always looking for the minimum, right? The minimum exercise for the maximum benefit. Does it mean exercising more is harmful? No, you get marginal benefits after that. And I'm not talking about winning a race, winning a championship, triathlon, none of that. I'm just talking about the minimum for the maximum longevity.
Right.
Now, the next part gets a bit trickier. We think it's about 80% aerobic and 20% strength training. But if you look at the individual studies, the people living the longest did about 10 minutes of strength training. Most of it was upper body strength training 3 times a week. So of the 150 minutes, if you could do 30 minutes of more upper body than lower, but all of it is great, the more the better. Exercise is the only thing on this planet that has 0 side effects. Everything we talked about so far has side effects. Exercise, 0 side effects.
Right.
So the more the better, but 150 minutes, if you can give 30 minutes of that to strength training, you've optimized that one risk factor.
All right, so 120 to cardio
Aerobic.
and 30 to weights.
Yes.
So wow, so what are the percentages of that? That's 80-20?
Yeah.
Is it?
What is that? Yeah, 30 out of 150. So it's almost about a fifth.
20%.
About 20%. There you go.
I can tell you over my experience as a trainer.
20% is weights.
The older I got and the older clients, when I focus more on strength training, I find that strength training keeps them strong, the joints, the muscle, the body, the structure, the bones. And the too much cardio kind of
Kills the muscle.
Deteriorates the body. And I've done this when I trained a marathon runner who's never lifted any weights, and I was training his wife, and his wife could lift more than him. His wife was stronger than him. Even though he looked healthy, he had no muscle mass. He was actually very weak, and I was very surprised, and I'm like, he couldn't lift the 10 pounds, and his wife was doing like 15.
You know, that's interesting. I've seen that too. I've seen people who just do cardio where they're just running all the time, and they age faster, and they look like fickle almost.
Their knees, their back, everything is shot at one
Whereas
point.
the people who do weights more, they always, it feels like they're younger. They look younger, they look stronger. They look, so I'm almost, like torn with, okay, should I just add more cardio, or or is this okay? Or I guess a little bit's always good.
Well, I mean, part of that is possibly just aesthetics, because as we lose our hydration and our fat tissue, filling that with more muscle maybe makes us look younger. So I don't know how much of that is health versus the look of
aesthetics,
it.
yeah.
But I also look at it as when you're exercising, you're pushing with the legs, you're pushing heavy, you're boosting testosterone at the same time.
Yes.
So I kind of look at the combination all together, like
Yes.
lifting weights.
Yes.
And I over my years I've trained so many different ways. Now I go for strength, 8 to 12, 8 to 15. I don't go to
Yes.
4 to 6 where I can injure myself.
Yes.
I train differently as well, where I'm going to make sure I'm not going to put any client to the risk of getting hurt. And I throw in the cardio in there as well. Like, you know what I mean? Like shorter bursts, high intensity. And again, it depends on each person.
So what if someone does like an hour a day, let's say
Yeah.
5 times a week,
Yeah.
and they do 40 minutes of weights and 20 minutes of cardio?
I think that's a perfect.
What do you
that's a good
think
combination.
that's how it works?
I think it's great. And if you look at the people from Ikaria we were talking about, so if you look at those blue zones where people are living the longest into their 90s and 100s in great health, they did do about an hour of exercise a day. Now, their definition of exercise from the olden days was a bit different. So they were walking at a pretty brisk pace up and down little mountains, which we can do in the gym. And to Nick's point and Sam's point, if you just look from the strength training point of view, again, as doctors, we're looking at other kinds of perspective, right? Not just the fitness and the training and the winning races and whatnot, but the thing that's going to keep you out of a nursing home is what? Your quads. Because if you don't have strong quads as you're 60, 70, 80, you can't get up out of the toilet.
Wow.
You can't transfer from the bed. So we say what defines whether you're going to end up in a nursing home or not is your quads.
Wow.
It's not
First time I hear that.
right. I mean, there's other things, but
a
that's
good
what.
point.
So wouldn't your legs be the most important to train more than your upper body?
So that's where it gets complicated. So for the nursing home, it's here. It's all important. But we don't know why the studies show that the upper body is more important, is equally or slightly more important. And why I think
But that, maybe that's more a cardiac point of
That's
view.
what I'm
a
thinking.
cardiac, and I think also when you're getting older, like 80s, you still need to put things on shelves. You still need to make your food. And if they're not strong up here, you are at a survival disadvantage. But you need this to transfer off the toilet, off your bed, so you don't fall down, break your hip. That's such a mess. You know, 50% of patients are dead at a year after a hip fracture.
I mean,
So
we're looking to make this, physical science, to the calculus degree, but it's really not a science, not an exact science. I don't think we're going to come up with the exact ideal recipe for what's the best way to exercise.
Right.
I think trying to find more the guidelines, getting in those hours, some of it cardio, some of it muscle, some of it lower body, some of it, it's we need it all.
Yes.
And the exact ratio, I think, is probably less important if you're getting all of that into your...
It's true.
You see,
It's true. As they say, little is better than none,
yes.
and a lot is better than little.
Exactly. To both of your points, because only 15% of Canadians are exercising regularly, just do whatever you can.
15%.
Only 15%, that's the 3 times a week, 150 minutes.
Wow.
So whatever you do, bonus and good for you. And to Dr. Steinberg's point, you see, you could exercise your head off, but you're not going to out-exercise your smoking. So there is a big picture to this, right? So
I saw a great documentary called Heal. And it talked about the power of the mind and how our thoughts, our mind, everything that we believe is the center of everything that we create, that every disease starts with stress, our mind, that we have the power to heal just through our thoughts.
Yeah.
What do you think of that?
Nick, that's what we mean. Like of those 7 risk factors, stress is moving up almost to the top. So in the old days, we used to say, your mind is in your body. So the mind is in the brain, is in the body. Makes anatomic sense. But the new days, the longevity experts say your body is in your mind. In other words, all of the things, almost everything you could do, not just psychological and thinking, but your whole existence starts probably in the central computer system. Wow. So it's a different shift in the way we're thinking.
Is there stress hormones? Does that exist, or is that a theory that we've heard about it?
Yes, we touched on those. So the stress hormone, the main one, there's probably many, is from that steroid family, and we talked about cortisol. So cortisol is the #1 stress hormone. And you see, to that point, in the time of caveman, it was fight or flight. So he had to run away from a saber-toothed tiger. So the cortisol went up when he had to run away from the tiger, then it went down. We were built like that. Now in modern day living, it goes up, it stays up 24 hours. That
Because you know what the tiger is.
And we
the
know
tiger's the bank.
And we know exactly.
What it is. It's running away from your mortgage and your payments, and the bank doesn't close down, man. Even when they say they're closed, they come after you.
24 hours.
Yeah, Revenue Canada, Revenue Quebec, that's the new tiger. You know what I mean? They don't stop chasing you when you owe them a little bit of taxes. Not from personal experience. I'm saying this because I'm a friend. I'm a friend, but.
And
So
We know exactly what cortisol does because there are diseases of the adrenal glands which produce too much cortisol. And so we could have a checklist. You know, it causes obesity, causes high blood pressure, causes diabetes. So these patients have excess secretion, not because of stress, but because of they're actually producing too much from their hormone gland. And it causes a whole bunch of dangerous stuff. So imagine that stress getting you maybe not to that high level, but getting you to a higher level than it should be can cause all these things.
It's that state of fight or flight that we're constantly
and being in a constant state of flight or fight, right? Like 24 hours. That's not good.
Because it's good to have a little bit.
Yes.
You're meant to have a little bit.
Yes.
You can't just have an easy life.
Yes.
Because that's called a princess. Nobody wants to be a princess. You know what I mean? Imagine having monogamy with a princess. Cortisol level up here all the time. Right?
heart attack, stress.
Heart attack, stress.
Shoot. Right.
Yeah.
It's like,
Yeah.
it doesn't make sense.
No, I think in
Powerful.
conclusion, that's what you gotta do. You gotta know when to stop. Say to yourself, I'm gonna move down to the islands. It's better for my health and tax haven. Running away from the saber-toothed tiger right there, no tax.
Powerful.
Very powerful.